How to react in this exact moment is a necessary life skill because roughly 1 in every 100 people experiences this condition. That means it is highly likely you will witness a seizure at some point in your life. And while many associate epilepsy with childhood genetics and development, it strikes across all age groups. In fact, cases among the elderly are currently increasing as a result of strokes, brain tumors, and dementia. Because a seizure looks physically aggressive on the outside, our reflex is to match it with physical intervention. But to actually protect someone in this vulnerable state, we have to pause and look at the invisible mechanics happening inside their skull. A healthy human brain relies on perfectly timed rhythmic electrical signals traveling calmly along neural pathways. Epilepsy occurs when those signals experience a massive disruption. Instead of an orderly rhythm, there is a sudden, excessive discharge of electricity, a temporary short circuit inside the brain. When this electrical storm overloads the entire system all at once, neurologists call it a generalized seizure, instantly knocking out consciousness. But the storm doesn't always consume the whole brain. In a focal seizure, the misfire is isolated to just one region. Recognizing this spectrum changes how we identify medical emergencies. A seizure isn't always a dramatic collapse. Sometimes the person remains entirely conscious, and the only visible sign of that internal storm is a localized twitch in their hand, or a sudden blank stare where they become completely unresponsive to their name. To stop these storms, doctors use 2 primary diagnostic tools. On the left, an EEG monitors brain activity, looking for sudden shifts into sharp, jagged spikes. On the right, an MRI scans the physical structure, searching for hidden triggers like tumors or scar tissue. Once diagnosed, the baseline treatment is remarkably effective through a strict daily regimen of anti-epileptic medication. Roughly 70% of patients are able to suppress these abnormal electrical signals and reduce their seizures to absolute zero. That leaves a critical margin of patients facing what we call intractable epilepsy. For these individuals, trying 2 or even 3 different medications still fails to calm the electrical surges. When chemistry falls short, neurosurgery provides a physical solution. If the source of the seizure can be safely pinpointed, surgeons can physically remove the tiny segment of misfiring brain tissue where the storm originates. If the tissue can't be safely removed, doctors can install a specialized implant. This small device sits near the collarbone and sends continuous, perfectly timed electrical stimulation up into the nervous system to proactively block the chaotic surges from forming. The takeaway is that epilepsy is highly treatable. It is a mechanical issue with proven chemical and surgical solutions. As long as a patient carefully manages common triggers like sleep deprivation and severe stress, they can typically maintain total control over their nervous system. Let's jump back out to the street. The person next to you has collapsed on the concrete, and the convulsions have started. With your new understanding of the brain, your mindset changes. You know this is a temporary electrical storm that needs to run its course. Your job is not to fight the storm by holding them down. Your job is to protect their physical body from the environment around them. This schematic illustrates the proper response. First, quickly push away any hard furniture or dangerous objects. Then, gently roll the person onto their side. This is the recovery position, and it ensures that saliva or vomit can drain out naturally, preventing a blocked airway. Once they are safely on their side, you must take the most critical step of all: check your watch. You need to time exactly how long the seizure lasts. You are waiting for the 5-minute mark. If a seizure stops before 5 minutes, you generally just need to stay with them until their consciousness returns. But if the convulsions cross that 5-minute threshold, it is officially a medical emergency, and you need to call an ambulance immediately. You should also skip the wait and dial emergency services right away if their breathing remains abnormal after the shaking stops, if they violently struck their head during the initial fall, or if a second seizure begins before they've fully recovered from the first. When it comes to neurological events, knowing exactly what not to do is how you protect a life. The combination of modern surgical and chemical medicine is powerful, but when we pair those treatments with a society trained to safely watch, wait, and protect, the 1 in 100 people facing this condition can navigate their daily lives without fear.